Dr. Calvin Sun is a clinical assistant professor in emergency medicine in New York, and he talked about what could be behind the president's quick discharge from hospital.
We have to first preface that the care that you and I will receive as common citizens will not be exactly the same as what a president of a country would receive. So whether or not he has continuity of care back in the White House where they will set up a clinic inside the Oval Office, that's well within the possibility to have him continue treatment in that space. And if he's on those cocktails, those are things that require at least 1 or 2 weeks to be as safe as possible. Obviously, we also respect patient autonomy as the 9 core principles. And in respecting a patient's autonomy, they can also elect to leave, whether against medical advice or on their own accord. And, you know, that's well within their rights if that's what the president wants to elect.
But is the regimen that he's been administered the same as another male his age would be getting?
Well, I speak from a perspective as an emergency room doctor, an emergentologist. I work at the majority of healthcare systems in New York City, at all of them. All this drug cocktail, these are things that are reserved for the ICU or when they get admitted to the hospital, upstairs doctors, different specialists, who, you know, will have to sign you up for a clinical trial for you to get into those things. That means there's a risk of those things not working or actually doing harm because not enough data is presented at the time. So it's a risky thing, and whether he's getting it because he's the president or because he wants to be more aggressive, that's something you have to ask their doctors and what they think. But definitely not something that you or I would have access to walking to the emergency room other than the steroid. But if his oxygen rates did already drop, which you have told us that's what the reports were, and it's back and forth, that's concerning. And maybe the steroids will open up, maybe the drug cocktail that's beyond our reach as emergency room doctors can access, maybe they will make the difference, but there's no slam dunk so far. Otherwise, we'd be all using it by now.